The data from the use of CDK4/6 inhibitors in metastatic breast cancer have been remarkably consistent across all the different trials and in the different settings. And that's a very broad statement, but we know that when they were introduced initially, that is the CDK4/6 inhibitors, they had a profound effect on progression-free survival that was consistent both in the first and second line setting. And now we're starting to see overall survival data emerge from each of the pivotal trials, looking at each of the different drugs that are currently available, palbociclib, ribociclib, and abemaciclib. And if we look at the individual trials that have been most informative, we have the Monarch 2 trial that looked at the combination of abemaciclib and fulvestrant versus fulvestrant alone. And that was a trial that clearly demonstrated that there was an impact on overall survival that was clinically significant. And the same can be said for looking at the other drugs when they were evaluated in a similar fashion, including the Paloma 3 trial, which was a palbociclib trial in which palbo was combined with fulvestrant or for fulvestrant alone. And a similar survival benefit was found in these patients who had previously received endocrine therapy. And then finally, the data with ribociclib was demonstrated in the MONALEESA-7 trial, which was a trial conducted in pre- and perimenopausal women rendered postmenopausal by getting goserelin, in which they either received tamoxifen or an aromatase inhibitor alone or with a CDK4/6 inhibitor, in this case ribociclib. And this trial also demonstrated that there was an impact on survival favoring the inclusion of a CDK4/6 inhibitor, in this case ribociclib. And the interesting thing there is that it demonstrated for the first time that in premenopausal women rendered postmenopausal, the impact of a CDK4/6 inhibitor was very much the same as what we see in postmenopausal women. And then finally, the MONALEESA-3 trial that Dennis Lehman published in the New England Journal of Medicine showed a similar finding to all the other trials that I've mentioned, and that is when you combine a CDK4/6 inhibitor, in this case ribociclib, with fulvestrant compared to fulvestrant alone, you see the same impact on survival. So there's been a consistency across the trials demonstrating that using this class of drugs in combination with endocrine therapy, now in the setting where you're using fulvestrant, has impacted in a positive way with overall survival. And in the MONALEESA-7 trial, you could demonstrate a similar impact on overall survival when combining ribociclib with goserelin to render patients postmenopausal, either with an AI or tamoxifen, and see the same impact. So I think it's been a pretty remarkable demonstration of consistency with the class of drugs that we widely use today.